Today we will talk about the prevention of prostatitis. In the video you can also learn about exercises to prevent the disease, so please watch this video to the end. Prostatitis is a disease characterized by inflammation or infection localized in the prostate gland. Inflammation is caused by bacteria entering the prostate. There are many forms of the disease. However, most often, it has an acute or chronic form. Acute forms are when the ailment occurred at the moment and does not actually bother the man. The chronic form occurs when people carry the disease on their feet without going to the doctor. Typically, prostatitis develops into a chronic form after 3 to 6 months. According to statistics, men under the age of 50 suffer from prostatitis. Often the disease is characterized by severe pain symptoms, neuroticization of the patient, the development of persistent urinary disorders, sexual dysfunction, and infertility. Timely and reliable diagnosis is extremely important, as well as full treatment of prostatitis. Tips for preventing prostatitis. Protect yourself from infections. The main cause of prostatitis is infection. Therefore, it is extremely important to prevent harmful microorganisms from getting into the prostate. 2 kinds of germs can enter the organ: the causative agents of venereal diseases and E. coli. In the first case, the preventive measures are clear. Contraception methods should always be kept in mind. E. coli can enter the body from dirty hands, not washed after going to the bathroom. Do not overcool yourself. Because of hypothermia, the immune system is weakened, and blood begins to stagnate in the pelvic organs. If you get too cold, the same E. coli, which is normally present in our body, can begin to multiply rapidly and get to the wrong place. The resulting stagnant blood leads to swelling of internal organs, including the prostate. As a consequence, urine passes less easily through the urethra, and it becomes easier for germs to multiply. It is important not to overcool yourself, and always soberly assess your strength in the hardening process. In case of sudden hypothermia, the body cannot resist the infection with which it successfully coped before. Move more. In today's world, people spend most of their time sitting in offices, afterwards driving a car, and at home taking a comfortable position on the couch. As a result, the body catastrophically lacks movement. Lack of movement in life is the beginning of blood stagnation in the body, due to which the pelvic organs are compressed and work worse. Do not abuse alcoholic beverages. Alcoholic beverages lower the immune system, making the body less able to cope with infections. Alcohol also dilates blood vessels, which leads to all kinds of stagnation and swelling. Exercises to prevent prostatitis. Properly selected physical activity increases the blood supply to the organs and tissues, activates breathing and metabolic processes. Physical activity improves the functional state of the nervous and muscular systems, as well as the psycho-emotional state. In the treatment of prostatitis, an important role belongs to physical activity. It affects the intensity of blood circulation and metabolism in the prostate gland. The contraction of the pelvic muscles has a direct massaging effect on the organ. A combination of exercise, therapeutic gymnastics, and maintaining a healthy lifestyle is a fairly effective method of preventing prostatitis and alleviating the symptoms of the disease. Exercises for prostatitis are divided into 2 categories. One type can be performed almost invisibly, in any comfortable position, sitting, standing, while walking, or lying down. They are called Kegel exercises for men. The exercises work point by point, developing the small pubococcygeal muscles. Others will require a fitness mat or a hard mattress and some free time. These exercises train small muscle groups, the lower back, hips, and buttocks. An important factor in any workout is regularity. It is better to give only 5 minutes a day to the exercise, but to do it constantly than to do a whole hour, but once every 2 weeks. The first Kegel exercise. To perform it correctly, you need to sharply squeeze the muscles of the perineum for a few minutes, as if squeezing the sphincter. This should be done quite strongly, but the legs, buttocks, and abdomen should remain relaxed. Only the pubococcygeal muscles work. It is located around the anus. Next, you need to relax the crotch, rest for a few seconds, and then tension the muscle again. Repeat the exercise 15 times. Over time, when the perineal muscles get used to regular exercise, you should increase the number of repetitions. The exercise helps to cope with the following problems: congestion in the pelvic area, predisposition to prostate diseases, problems with erection, dysuric disorders. The second Kegel exercise, performed in the same way as the previous one, but gradually. It is necessary to slowly tense the muscles of the perineum up to the maximum for 5 seconds. Then stay in this state for 5 seconds and smoothly relax the muscles for 5 seconds. Repeat 15 times. In total, the exercise takes about 15 seconds. The third Kegel exercise. This type is divided into stages. First of all, it is necessary to slightly tense the muscles of the perineum to hold them in this state for 3 seconds. Next, the tension should be slightly increased, and again hold for 3 seconds. Gradually, stopping at each stage, it is necessary to reach the point of greatest tension, and then relax. Frog lying on your back. Lie on your back, bend your knees, and rest your feet on the floor. While doing this, slowly open your knees with your feet closed. Next, you should return the legs to the starting position. While bringing the knees together, you should tense the hips and bring the legs together with a little effort. Repeat the exercise 15 times. Gradually increase it to 20 times. Frog with leg pull-up. For the exercise, you need to sit on a hard surface. Place a roller under your head. Lie down with your arms stretched out along your torso. Keep your legs straight and brought together. Then you should slowly and smoothly pull your legs up to your belly, simultaneously pulling the knees apart. There should be no discomfort or painful sensations when opening the knees. There is no need to pull them to the sides on purpose. It is necessary to separate them as much as possible without overstraining. During the exercise, the heels should not be lifted off the floor and smoothly glide on the floor. The feet are in contact with each other. From the frog's position, you should slowly slide your heels down, gradually bringing the knees together, returning them to their original position. Number of repetitions of 10 times gradually should be brought to 20. Lift the hips. To do this, lie on your stomach, bend one knee, and raise your lower leg perpendicular to the floor. Then, keeping it perpendicular, lift your thigh off the floor. Lift it very slightly. It is important that there is no tension in the lower back. Repeat 6 to 10 times for each leg. Half squat. Starting position. Stand up with your arms stretched out along your torso. Next, slowly perform squatting, with your hands raised in front of you up to shoulder height. Squat shall be shallow, about half the height of the thigh. Afterwards, slowly straighten up, standing still for a few seconds in a slightly crouched position. Don't straighten your knees completely. Repeat the exercise 10 to 20 times. Bicycle. To do this exercise, place yourself on the floor on a gymnastic mat. Lie on your back, lift your legs up, and pretend to ride a bicycle. The exercise helps with adenoma of the prostate, improving blood circulation in the pelvic tissues. Glute walking. To strengthen the muscles of the pelvis and hips, as well as to restore a healthy erection, it is useful to walk on the buttocks. To perform the exercise, you need to sit on the floor, keep your back straight, and stretch your legs out in front of you. Next, you need to try to move forward on your buttocks without pushing off the floor with your hands, but they can be waved. At first, you should only move forward in this way, but later you can complicate the exercise and move backward. The gluteal lift. This is a traditional bridge. To do it, lie on a gymnastic mat on your back, stretch your arms along your torso, and bend your knees, resting your feet on the floor. You should inhale and bend in the lower back, doing Kegel exercises at the same time. Stay in the upper position for 1 or 2 seconds, and then as you exhale, slowly lower yourself down. Stand on your shoulder blades. To perform the rack, in a relaxed lying position, straighten your legs and slowly lift them up. At the same time, the whole body from the shoulders and legs straighten in one line, taking an upright position. The waist can be supported with the hands, resting the elbows on the floor. While doing this, the chin presses on the chest. It is necessary to maintain a static position. and keep the balance. This pose ensures the outflow of blood from the pelvic organs, due to which the unpleasant symptoms of prostatitis are relieved. Painful feeling of tumescence in the crotch area. That's the end of the video. Subscribe to the channel and like this video. See you later.